The Diplomate program and all of these topics and subjects that we are diving into really has allowed me to sort of see the world in a different lens. When you study something to the extent that a program like this, really forces you into, you can't look at the same thing twice and say, this is exactly what it was, after, learning all this information. You're talking with healthcare professionals on their level in a way that they understand. Not only do they understand what's going on, but you can see things and share with them things that they're not even aware of.
Going through the Diplomate really allowed me to add some pieces and fine-tune that. It really allowed me to evolve my practice.
It has completely changed my practice. I feel like I was actually practicing with blinders on before.
I feel more confidence in sharing the knowledge that I have of this upper cervical area.
Before I even signed up for this program, I thought that I had a pretty good grasp on what upper cervical care was. I thought I had a great grasp on the techniques, but it wasn't until I had heard Dr. Rosa speak down in Atlanta that I realized I had a lot more to go.
It covers advanced imaging and biomechanics of the upper cervical spine, complex neurology that I never thought I was going to be learning. But these topics, these intense topics, have seriously reshaped the way that I look at both simple and complex cases.
Originally, I was trained in one procedure, and that was the only way I really knew how to view the spine and the misalignment and how to approach that. And since going through the Diplomate, I've incorporated a whole other perspective.
I feel like understanding other techniques helps me to approach complex cases. So I'm utilizing different procedures. I don't feel like I'm so stuck in my technique box anymore, where I can really incorporate other concepts and other ideas from other techniques.
It allows us to look at both the really broad perspective of a patient's care as well as the very minute details that somebody who hasn't taken the time to specialize in this may miss.
We've tried to explain and situate ourselves in the middle of good scientific thinking and good scientific method.
We set ourselves to a markedly higher standard as a result of what we've learned and how we've learned it.
I think it's for people that want to become a leader in upper cervical, want to advance their understanding of complex cases, to be able to help that maybe 10% of people that they might have really struggled with, or that most of medicine is really struggling with.
And we like to think that our diplomates and upper cervical chiropractors that have the Diplomate status have that ability to walk that line, to provide excellent upper cervical chiropractic care, but have the maturity and knowledge to know if and when you need some co-management by other paraprofessionals.
So I have learned how to communicate better with them, learning their procedures, and to see what's best for my patient.
So when we go for a Diplomate training, we're not going for the 70, the 80, sometimes even the 90% of people that we already are having fabulous results with. We're going for the 5, the 10, the 15, the 20% that we need to know more. And when you train through the Diplomate program, the 3 years, the 23 different weekends, you elevate your game to understand that last 5% of people that need you to have the knowledge so that you can help them. That's what the Diplomate training and what the advantage of having a Diplomate as your clinician gives you.